Symptoms of hemophilia in children. Patients with less than 1% severe hemophilia factor 8 or factor 9 have spontaneous bleeding, often in joints or muscles, hemarthrosis. For bleeding with minor trauma, patients with 1 to 5% moderate hemophilia factor 8 or factor 9 usually require moderate trauma to induce bleeding episodes. In mild hemophilia, 5 to 40% factor 8 or factor 9, significant trauma is necessary to induce bleeding. Sex-linked recessive, so mostly boy have it. Girls carrier, they show milder symptom, joint, muscle, soft tissue bleeding, hematuria, intracranial bleeding, retroperitoneal bleeding, prolonged APTT, normal PT, recurrent varices, hematoma formation, or mucosa bleeding, epistaxis, excessive bleeding following small procedure. Bleeding from joints called hemarthrosis, muscle, soft tissues, or mucosa, recurrent hematoma or bruising, or mucosa, bleeding, epistaxis, excessive bleeding, and dental procedures, CNS, melanohematemesis, hematuria in infantis and unexplained irritability. Petechial bleeding is a common sign of platelet disorder, but not all coagulation disorders. Hemophilia is a genetic disorder characterized by the inability of the blood to clot properly due to a deficiency or absence of certain clotting factors. They primarily affect males, with females typically being carriers of the condition. Hemophilia A, deficiency of factor 8 is the most common type, followed by hemophilia B, deficiency of factor 9. The severity of symptoms can vary widely, depending on the level of clotting factor activity. Common symptoms in children with hemophilia include excessive bleeding, prolonged bleeding from cuts or injuries. These are hallmark symptoms as the blood does not clot as it should. Spontaneous bleeding. Bleeding can occur without any apparent cause, affecting joints, muscles, and internal organs. Joint bleeding, hemarthrosis, frequent bleeding into joints, especially knees, elbows, and ankles, leading to pain, swelling, and stiffness. Repeated episodes can result in joint damage and arthritis over time. Easy bruising. Children may bruise easily and excessively, even from minor bumps or injuries. Bleeding in muscles, hematomas. Bleeding within muscles can cause swelling, pulse pain, and limited movement. Bleeding in the mouth and gums. Prolonged bleeding from minor cuts or after dental work, and spontaneous bleeding from gums, nosebleed. Frequent or prolonged nosebleeds are common and may be difficult to control. Blood in the urine or stool. Hematuria, blood in the urine or blood in the stool, may indicate bleeding in the kidneys or gastrointestinal tract. Cerebral hemorrhage, bleeding in the brain, is a severe complication that can occur from a head injury or spontaneously. Symptoms can include severe headache, vomiting, stiffness, sudden weakness, vision changes, and altered consciousness. Prolonged bleeding after circumcision. In newborn with hemophilia excessive, bleeding after circumcision can be early sign of the disorder. Excessive bleeding after vaccination. Prolonged bleeding at the injection site following routine vaccination. The severity and frequency of bleeding episode in hemophilia can vary widely. In severe cases, spontaneous bleeding or bleeding from minor injury can be frequent and difficult to control, while in mild cases, significant bleeding may occur with surgery or major trauma. Early diagnosis and treatment are crucial to manage symptoms and prevent complications. Treatment typically involves replacing the missing clotting factor through regular revisions, and in some cases, prophylactic preventive treatment to reduce the frequency of bleeding episodes. Neurotherapies that help stimulate the production of the clotting factor or mimic its action are also available for some patients. So let's sum up. Symptoms of hemophilia in children. Patients less than 1% severe hemophilia factor A, 9 have spontaneous bleeding, joint muscle hemarthrosis, bleeding with minor trauma. Patient with 1 to 5% moderate hemophilia factor 8, 9 induced bleeding episodes. In mild hemophilia 5 to 40% factor 8, factor 9, significant trauma is necessary to induce bleeding. Sixth linked recessive, so mostly boys have it. Girls' carriers may show milder symptoms. Joint muscle, soft tissue bleeding, hematuria, hydroperoneal bleeding, retropectoneal, retropharyngeal bleeding, prolonged APT-TPT, no more. Recurrent bruises, hematosis formation, or mucosa bleeding at distances, excessive bleeding following small procedures. So bleeding from the joints called hematosis, muscle, soft tissues, or mucosa, recurrent hematoma, or bruising, or mucosal bleeding epistasis, excessive bleeding after dental procedures, and melanoma. Hematomesis, hematuria, lymphatism, unexplained irritability, petechial bleeding is a common sign of platelet disorder, but not a coagulation disorder. Hemophilia is a genetic disorder characterized by excessive bleeding, spontaneous bleeding, joint bleeding, hematosis, acid bleeding, bleeding in muscles, hematomas, bleeding in the mouth and gums, nosebleed, blood in the urine or stools, hemorrhage, prolonged bleeding after circumcision, excessive bleeding after vaccination.